pediatrician, stroke lecturer. We are waiting on the technical people.
Understanding breast cancer.
Pay attention. Thank you.
Breasts are made up of fatty tissue. They contain small chambers called lobules where breast milk is made. The milk travels through tiny channels called ducts to reach the nipples. Lymph nodes are located inside your breasts and under your arms. They are connected by lymph vessels and they help your body fight disease. Breast cancer occurs when healthy breast cells become abnormal, grow out of control, and form tumors. Breast cancer can sometimes spread to other parts of the body. About 1 in 8 women have a lifetime risk of getting breast cancer. For men, the risk is 1 in 1,000. Breast cancer that develops inside the milk ducts is called ductal carcinoma in situ, or DCIS. When DCIS spreads into surrounding tissue, it is called invasive ductal carcinoma, or IDC. Abnormal cells can develop in the lobules of the breast. They are called lobular carcinoma in situ, or LCIS, and are not cancer. When these cells spread into surrounding tissue, they become a cancer called invasive lobular carcinoma. Signs of breast cancer can include a lump in the breast or armpit, a change in breast shape or size, nipple changes or discharge, and skin changes, including redness, inflammation, or dimpling like the skin of an orange. Risk factors for breast cancer include older age, dense breasts, having breast cancer before or having a parent or sibling who had it, having specific inherited gene mutations called BRCA1 and BRCA2, having Ashkenazi Jewish ancestry, drinking more than a small amount of alcohol, and being overweight or obese, especially after menopause. Screening for breast cancer can help find cancer early and save lives. Screening includes examining your own breasts, having a healthcare provider examine them, and having an x-ray of the breasts called a screening mammogram. You can check your own breasts about the same time each month. Feel each breast and armpit and look for any of the signs of breast cancer previously discussed. A diagnostic mammogram is used when a change is seen on a screening mammogram. It includes extra detailed images of the breast. A breast ultrasound is often used to determine if a suspicious lump is solid or fluid-filled. A fluid-filled lump is often benign or a cyst, while a solid lump can be cancerous or a benign fibrous growth. A breast MRI shows more detail than a mammogram and is often used for very small masses or changes in the breast that cannot be seen by mammogram. A breast biopsy is a test that removes a few cells or a small amount of tissue from the suspicious area in the breast. There are various types of biopsies. A doctor called a pathologist will analyze the breast biopsy tissue by looking at the cells under a microscope and doing specific tests. Their report will let you know if you have cancer and if it grew because of estrogen, progesterone, or HER2 protein on the cancer cell. The results of these tests help your doctor choose the right treatment. Doctors classify breast cancers based on how they behave. This includes non-invasive, cancer that has not spread outside the tissue where it began. Invasive, cancer that has spread and invaded healthy tissue. Recurrent, cancer that returns after it was treated. And metastatic, cancer that has spread from the area where it started to other areas of the body. Common types of breast cancer are invasive ductal carcinoma and invasive lobular cancer. Less common types of breast cancer include inflammatory breast cancer, tubular breast cancer, colloid breast cancer, and metaplastic breast cancer. Triple-negative breast cancer means the tumor has no estrogen, progesterone, or HER2 protein receptors on its surface. Triple-negative disease may have a worse outcome and often requires more intensive treatment. Breast cancer staging is determined by the size and location of the cancer and whether it has spread to other areas in your body. Breast cancers are graded 1 through 3, with 1 being the most similar to normal, healthy cells, and 3 being the most different from normal cells and the most aggressive. Breast cancer treatment depends on the type and stage of your cancer. You will need treatment from a cancer team specializing in different areas of medicine. The main treatments include surgery, radiation, chemotherapy, hormone therapy, targeted therapy, and combination treatments. Common types of surgery for breast cancer are lumpectomy, removing the tumor and a small portion of healthy normal tissue around it. Simple mastectomy, removing the entire breast. Modified radical mastectomy, removing the entire breast and lymph nodes under the arm. Prophylactic mastectomy, removing one or both breasts to reduce the risk of developing breast cancer. Mastectomy with reconstruction, reconstruction at the same time as removal of the breast. Sentinel lymph node biopsy, a procedure to determine if one or more lymph nodes contain cancer cells. And axillary node dissection, surgery to remove lymph nodes in the armpit region. Reconstructive surgery is a procedure done to restore the appearance of the breast after a mastectomy or large tumor removal. Radiation therapy uses radiation energy to kill cancer cells. It is mostly recommended after surgery or chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells. It is given as an IV or a pill. Chemotherapy can be used to shrink a tumor before surgery, called neoadjuvant chemotherapy. Kill cancer cells after surgery, called adjuvant therapy. And control metastatic breast cancer, called palliative chemotherapy. Hormone therapy is given if your tumor is positive for the hormones estrogen or progesterone. Hormone therapy is used to lower the risk of breast cancer coming back and help shrink or slow the growth of metastatic estrogen receptor positive breast cancers. Tamoxifen and aromatase inhibitors are common hormone therapies for breast cancer. Targeted therapy uses drugs or other substances to identify and fight specific types of cancer cells with less harm to normal cells. Targeted therapies stop cancer cells from growing, identify and kill cancer cells, and increase the immune system's attack on cancer cells. HER2 is a common protein that is blocked with targeted therapy, for example, trastuzumab. Targeted therapy is often given along with chemotherapy. Metastatic breast cancer is cancer that is spread from the breast to other areas of the body. The most common places are the liver, bones, lungs, and brain. There is no cure for metastatic breast cancer, and treatment is to prolong survival. Today, people are living 5, 10, or more years with metastatic breast cancer due to advances in treatment. Metastatic breast cancer treatment may include ongoing chemotherapy, hormone therapy, targeted therapy, and new innovative medicines in clinical trials, such as immunotherapy. Survivorship is a term used to describe anyone who has had breast cancer and is still living. As a survivor, you will have different care needs than when you were in treatment. Your cancer team and primary care doctor can help you meet these needs in the years after treatment. It is frightening to learn you have breast cancer. However, the information available can help you receive timely, individualized, effective treatment that can give you the best chance of being cured. Ask your doctor or cancer team if you have any questions about your treatment plan.
Thank you for watching. I hope that was informative. Now, is there any question? Yes, sister.
I want to know, for women, we say you need to do, yes, for women, we say you need to do self-examination and mammogram. What's the name of the mammogram? Yes. To know if you have breast cancer for women. But for the men, how do they know if they have, what are the methods they use?
Right. So the evaluative modalities remain the same for men. It involves a breast examination. Now, naturally, a more slender gentleman would find it a little bit easier to see an abnormality, but the abnormalities remain the same Interestingly though, if you were quite clear on the details, I thought it was a little exhaustive in terms of information for a person who is not clinical. But breast cancer is linked to estrogen, and estrogen is actually a hormone that is quite assisted by fat. So it means therefore that especially the gentlemen that are heavier, with more breast tissue, more fatty tissue about their breast, then they are the ones that should be a little bit more consistent with their examinations. Now, I want you to bear in mind that breast cancer in men is pretty rare. It's pretty rare because just because of how it functions, because of the hormones that regulate it. Typically, it's a hormone-related illness. Now, if, however, a man, though, he has the gene mutation, the special gene mutation that is related to breast cancer, then he's at additional risk. Especially if he has one, the mutation, and he has first-degree relatives that would have had a history of breast cancers. Now, the world has modified a great deal. It's not like 20, 30 years ago. You have different assignments at birth as opposed to what we choose we want to be when we are adults. Apparently children are emancipated now and they are allowed to be born with a penis, but yet when they are 10 or 11 they say they are not boy again. Now, for those persons who were assigned female but have undergone therapy, or vice versa, especially persons who are undergoing extensive hormonal therapy because they're trying to modify how their body functions and responds to hormones, they are at an even more exaggerated risk of cancers. All right? Any other questions?
My question is traditional treatment goes without science.
That is correct.
So, what is the relation to lung cancer? Which medicines?
I am going to be very frank. I am not a holistic physician. I did Western medicine, so I can't speak on the holistic aspects, even though persons have had successes with holistic medicine, so I'm not going to knock that, but it's not an area that I'm very au fait with. So I will now comment on what we know to be traditional therapy. So here we actually have a survivor here. She's a survivor, breast cancer survivor. Mrs. Gibson, she's a pharmacist here in Rema, a registered pharmacist. But she has a lot of experience, and I'm sure you guys can pull off from.
So I think she wants to address what.
Good afternoon, everyone. No, good morning. Yes. Now, the question about alternate medications. Once you are diagnosed with the condition, you can speak to your oncologist. They will guide you. For me, being a survivor of breast cancer, I do use alternative medications, right? One of the key things that I notice is not promoted in cancer awareness is that the high intake of sugars can be a big contributor, can also be a big risk factor, right? So there is a need for persons to either limit or come off sugars. I must say that I was a sugar lover, right? The cakes, the Pepsis, one stress kick in, that would be my meal. Once I was diagnosed, the day when I was diagnosed, I had to park them. Now, if I even put a touch of sugar in my mouth, it tastes so awful, right? So, one of the things that I do or use as alternative medicine is the use of the sauce leaf. That's a very popular one. The barks, yes. I boil it, and I drink it like water, right? Another thing that is very popular among breast cancer survivors is the use of the apricot seeds, bitter apricot seeds. It's bitter. But one of the things I ensure that every morning before I do anything is 3 of those little beads into my mouth, right? And what it does, it provides vitamin B17, which is highly used in inflammatory procedures. So yes, it does work, right? I can recall a testimony of a lady at KPH who had breast cancer. And if you listened to the video a while ago, everybody's journey was different. She had a big mass, she was having, it was highly inflamed. And because you work or you go to the public setting seeking attention, the time frame to do or to receive treatment can be longer than if you go private, right? So she had her soursop, everything in soursop, the fruit, the leaves, the bark, you name it. The surgeons were surprised that the mass shrinked. So yes, there is some proof. And you also have to put that belief that God can turn things around for you, right? It's not just a medicinal thing. It has to be a belief, that faith that God can turn things around. All right? Thank you.
So I want us to also be mindful, right? Because in our home, though I cannot advance holistic medicine because I'm not a practitioner, we use natural means every single morning. Like, for example, now I'm having chai tea, which is a combination of cinnamon and all sorts of spices that have inflammatory properties to them. So, additionally, there are other things that we have available to us. Ginger, turmeric, all of those things, I can recommend them because certainly, especially if you have an inflamed knee, you will find that if you blend it up and you have a shot of it, then by later you may feel a little bit of ease. But all things of course, in moderation, guys. Especially if it is that you are seeping your meds, because most of them have to be metabolized by the liver. And as such, you don't want to be trying to address one issue and you create another by burdening your liver cells, overworking them, all right? Because they have to be filtered by it, so they can in fact injure it if we have burdened them.
Pharmacist, please remember sort of the seed, the name of the seed.
Apricot.
Apricot?
Yes.
Some people know what that is.
Apricot is a fruit that it looks almost like a peach, but it has a larger seed, it has this hard thingy, but it's bitter bad enough. And in addition to it though, you have to read up about the use of apricot seeds because used in excess, it has its own negative side effects. You hear? Apricot seed? Of course, most
herbal stores.
The herbal stores, they can be had there.
Or if you have, how do I get my supplies? I ask friends from overseas. Once they go over, it's about 10 US, and I get my apricots. And even if you are not diagnosed, yes, I would recommend precautionary. You read the label as to how much you take and don't exceed. All right?
So as it relates to prevention, we were hoping that we could push that fee because nobody wants to really be caught in the whole sequel of having to have to treat it because again it can be really demoralizing and it is an arduous process, as my sister here, she has said to you. Prevention. Alright, you see the video had alluded to If we can kind of do there too, those of us who may be carrying a little bit more weight than usual, to be honest, if you check most of us BMI, most of us are overweight. But it speaks to obesity, just as what I said before, so we have to try and manage our weight. That's one. Excessive alcohol use, and this is for both men and women alike. You may want to decrease that. And as we had said, and we are pushing, please, especially in and around your cycles, those of us who still menstruate, please ensure that you're doing your self-breast exam. Subsequent to menopause, which is when the numbers spike a little bit more, about 50 years of age, that is the typical presentation. I know we're hearing a lot of things, women way under even 40, which is why they have actually moved. The target has moved now, and especially if you have a first-degree relative, we try to do the exhaustive evaluation to try and rule out breast cancer from as early as 35 years of age. So we want to start earlier screening. Ladies, if you're in a high-risk group, you go do your mammograms yearly. They say twice, they say every 2 years at the very least. Some persons they stretch it to 5 years. But if you have an increased risk, meaning you have a relative with it, please jump on it.
Is there anything else you want to say? Is that a hand up? Is there a question? Oh, it's a young man's question. So, we don't want to burden you. We don't want to waste any time. But I'm so happy. Yes, right? I see you.
I mean, I want to give God thanks for the knowledge that is among us. Yes, I give God thanks for that. But I want to get a response from any of you, and thank God that all of you are Christians. To what extent would you suggest that men who have significant others, whether a sister, a mother, a wife who is struggling with this, and in particular those ladies who have lost breast, how we help to journey with them, at the same time understands that God is still with them for them. Who want to respond to that?
Thank you, Red. I was waiting on that line of thing because anyone that knows me know I love to love. And one of my things is cancer. When you hear people talk about it, they don't say the word cancer. They'll tell you the big C. And what I want to tell all of us, no matter what illness is it, nobody calls illness on yourself. Yeah, sometimes we do it, tell the truth, when we don't want to go to work and we're calling sick. But genuinely, nobody wants to be sick. So nobody calls an illness on themselves. And as such, it's a when you go to the doctor, you can see with diabetes, the doctor is going to tell you that you have. It's a bitter pill to swallow, Because when doctor says this is cancer, all you can see is the casket and that you're 6 foot under the truth. Am I lying? Nobody can tell you anything else. All you're seeing is the grave. And my thing is, speak to each other about it. Talk to somebody. It is not a death sentence, and the support is needed. When I say needed, it is needed. When you go to the doctor to get the news, for every treatment, for every test, for the illnesses persons face after. I walked with my I call her my other mother. She adopted me when I was very young. And I could remember she went for a treatment on the Friday, and we would go to Chinese, and I'd make sure she eats, because by Monday she cannot eat. She was vomiting. So I was happy she ate on the Friday, but the fact that she knew I was there, it was like a breath of fresh air. So to love each other, it's not to go and criticize. If you go in the place like you want to brush up the place and come out. If you're not going to brush up, do not go. Because you're not going there to be nosy and gossip. You know, I'm going to talk level because this is what it is. You're going there to give love, to pray, to strengthen, to encourage. Because going through the treatment can be discouraging for persons. Just the feeling alone, you're just tired. And all you want, I think those persons want, is just to vent, to know that they have a listening ear. Now, not all of us is supportive that way to listen, right? But we can go and sweep up the yard, because that is what we are called to do. You can go to pray. So we have our own little gifts that we go to support each other, support the family. Sometimes the family only needs a break, so they can go to the supermarket, go to the doctors themselves. So that little support is there, is necessary. And it's not only to the hospitality team in church. You know, you have some persons in church, they're every Sunday, every Monday, they're visiting. It's not only, it's all of us. And it's that support alone can make that person well. So it's, when we say family support, it's not only the immediate family. It extends to the church, it extends to the wider community. Thank you. Rev, did I answer you?
Well, very well.
All right, so we're going to lean on each other then and seek counseling. There's, what?
I'm grateful for what is happening. Very grateful. I am encouraged, although I have medical experience, I'm very encouraged. I've learned a lot. And things, you came with your good self, who had the condition, and to encourage us. You said, give us the medical care, and you gave us the social care. I am extremely happy. What you said, people are so afraid to call that name. And you will have many friends walking around with you, and know you could be a best friend, and nobody said anything to you, a best friend. It is a sad situation because we didn't buy. With one sickness we did not buy. Diabetes, as you said. I remember I was at work one day, and I went to the office and saw somebody crying, a nurse, a registered nurse. And I said, what's the problem? And she said, I heard that I said, what are you doing? I said, you're crying. But diabetes, this is something so common. And it doesn't kill people as you hear. I said, just give God thanks that it's just give God thanks that is diabetes. So we have to be careful. We do not know what we are walking around with. We may have diabetes, we may have a lot of things. But cancer is one thing. If you're not careful, it's at the peak when you realize. So we have to prepare ourselves. We have God as our caregiver, as our support, and we have others. And I thank you for what you said. When you go to the homes, be careful or you visit. Be careful. I have a church sister and a friend, and she said she doesn't want anybody to, she doesn't like to see tears, or she doesn't like tears. So we have to be cautious. Okay, thank you all.
One other thing, because Mrs. Miller is going to give her a synopsis of her own journey, which is going to be crucial so that we have an understanding of what people go through with a challenge such as this. But what I want you guys to know that the optics have completely changed for illnesses of this time. I'm just going to speak about breast cancer because we have many other cancers that exist. But the survival rate The survival rate for the most common cancer is a 5-year survival rate of 90-odd%. The second most common has a survival rate of 86%. And then, even the ones that follow that, it's still relatively high. So I want us to be mindful that if one, we have very good practices in terms of how we eat and take care of ourselves, because as a matter of fact, I'm going to recommend exercise for everybody. Not just for weight management, but just for health. Because even exercise decreases the risk by 15%. You hear? So bear in mind that the survival rates are that high. I want us to stop seeing it as a death sentence. Stop treating the persons that are challenged as such, as people that are near dead, and let us just try and enjoy our existences lovingly in God. Right?
Now, you have a question, sir?
And we just have 5 minutes to wrap up.
Okay, right.
Good morning. I know sometimes we talk about we're talking about the social care, the love and everything, but I will implore you, critical illness coverage can form a large part of your survival. Because the first thing we think about when we have cancer in our home, the cost, and to get the best care. And if you don't have that resources and money set aside, I tell you, you won't get the best care that we need. The critical illness coverage should form a part of our financial portfolio. Oh, I'm here. From Sergeant Corps.
Free hand.
So, in closing, before we close, Sis Miller will give us.
Oh, sorry friends, I was just trying to ascertain if the offering. Deacon, those who are leaving, did you make your offering for cancer care? Yeah? Alright. So we just have that to do, and then after the pharmacist.
Reverend, they were asked to drop it in the basket at the back door, sir.
No. Was it not just, it wasn't done? Was it done? It wasn't done. So I'm going to ask us, it was done? Oh, some of us did it. Sister Carr? Alright, so in the meantime, while she's speaking, I'm going to ask for you to give generously so that we make a contribution from Grace Baptist to the Cancer Society.
Good afternoon, everyone.
Good afternoon.
Thank you, Pastor.
Oh, it's morning, yes.
It's morning. I hear you mention a few things which is very good. I went to my doctor and she told me that my sugar passed borderline. Every time I go, they say it was all right, but this time she told me that it passed borderline. And then she gave me some tablets. And I started to take the tablets. Then I find out that passing my urine, it wasn't nice at all. So I went back to the doctor. My doctor took me back to the doctor. And I went to the doctor. And when she checked the tablets that she gave me, give the infection. She gave me back the same tablet, even though it gave me infection, yes. I didn't take it. I could talk about exercise. I do my exercise and I drink my future Bible and the same thing they want to talk in the tower supply up to this morning. Me drink a cup of tower supply and up to Friday I went to my doctor. I don't take the tablet anymore and everything was fine. Everything was fine.
So what's up, please?
going to be brief. All right? Now, I guess you want to know my journey. And that journey started with doing a physical examination of myself, and I saw where my left breast looked a bit different. The scientific term is inverted nipple. And that led my curiosity to go to my doctor. One of the things I have to tell you is that nobody in my family had breast cancer, all right? So my doctor advised me to do a series of tests, and the results came back showing that there was a suspicious mass. That led me to do a biopsy, and it was confirmed that I had breast cancer. All right, it was referred as a ductal carcinoma, and it was invasive. However, they could not tell me the type because I needed the type to start my treatment. So I had to do further tests. And when that test came back, it said it was of the hormone nature. Of course, I am not young anymore. So yes, my hormones got haywire, menopause kicked in, and that led to my cancer. All right, so it was estrogen driven, and because of the duration that it took to get the results, there was a toss-up between my oncologists and surgeons as to how to start, but eventually they came to a decision that I had to get chemotherapy, and then I did my mastectomy, and after which I did my radiation. That journey with chemotherapy was one of my most challenging ones because I had to prepare mentally. One of the things I would like to say to women that once you are, anytime that you are diagnosed with this condition, do not hesitate to speak to someone. Do not keep it quiet. Somebody who you can trust, someone, it could be a church sister, it could be a pastor, because this is where my opportunity opened for help. Within days, within hours, I should say, my window of treatment therapy opened, right? And I would say this is a test from God. And because of obedience, I am still here today. All right? And I had my symptoms of chemotherapy. I lost the hair, yes. A lot of people will tell you the length of my hair, and I lost it. I never want to pay no mind because guess what? If it grow back, it grow back as long as I was alive, as long as I am going to live. And I can go out and do my God's work, that's all that matters. The nail beds got dark, the skin got dark too, but hey, it went within, I can't tell you, it took a short time for everything to be restored. It was amazing. And even though, yes, it was a moment of adversity, I felt the Lord's presence in my life. Hallelujah. I could smile. People would say, Mrs. Miller, it's with you. Oh, you look so. And I would tell them, and they would just pray with me. So, here I am, a survivor. Yes, I have some more tests to do. And I am giving God thanks that He has given me an opportunity to be here with you. And also, if someone else should happen to have this situation, don't be afraid to call me. At my church, there were 3 females that was diagnosed, and they were my helpers. They carried me through the rounds. Don't worry, you're going to have this, you're going to experience that. Another thing I will say, I had a son who was my tower of strength. He gave up everything to be with me. right? So every chemotherapy visit, operation at Maypen Hospital, he was at the theater door waiting. He saw everybody coming out, and he said, "Where is the mother?" It was 5 hours of therapy, of surgery, and when he said he saw his mother's foot, and he knows everything was okay. He was all right. And I want to share just one little journey in that. After completing my operation, there was a test from God where I was to now do my radiation, and my CT scan showed a bit of scare. And I went to St. Joseph Hospital, that's where they do radiation, and they said, "No, we're not going to progress because this is a spread." This is how the doctor was so confident that it was a spread. But my God had something different planned for me. All right? And I called up my prayer warriors, and we started to pray. Yes. Prayer works. Prayer moves mountains. Yes. And when I went back, as a matter of fact, sometimes you hear the term, every disappointment is God's appointment. Because God just never wanted me at St. Joseph. God wanted me somewhere else to get treatment. And so I found a doctor I came out of public and went into private, found this doctor, and he sent me back into public. And that was at Cornwall Regional. And he said, "Okay, Yvette, let's do the test over." I did over my CT, I did over my bone scan. Everything was cleared. Glory be to God. I proceeded to my radiation. And even to this day, he'll see me and say, "Miss Gibson, why are you so worried when you come to my clinic?" I said, "I'm just fearful of what the results might be." He said, "No, you have nothing to worry about. You are good. Your prognosis is good." And I give God all the glory. Nothing else. All right? So, ladies, don't be scared. Do your self-testing. If you see anything suspicious, go to your doctor. Don't wait until it gets out. What's interesting, I didn't know there was a lump. I just saw the nipple turned up like this. All right? You know how your nipples look, right? You have an idea. My nipples just turned up a bit, and I choose help. And that time it was a bit late because I'm at a stage 2. All right? So thank you for listening. And if you need any assistance, I'm at Miller's Pharmacy. Check me and I'll advise you. Thanks. Miller's Pharmacy is 27 Manchester Avenue, Maypen. I'm in the vicinity of Water Commission and JPS. Right beside Dr. Charles Robertson. And if you need my number, speak to Rema. Oh, if I never had this lady by my side, I couldn't have made it either. I give her all the thanks and support that she gave me. Thank you.
God, all the thanks and glory, not me. Ladies and gentlemen, I appreciate you staying back, for listening and making your contribution. Thank you.